Vladimir Yaffe, a board-certified radiation oncologist, discussing the treatment options for intermediate risk category prostate cancer. The primary treatment options for intermediate risk category prostate cancer are prostatectomy, external radiation, usually with hormone therapy, and brachytherapy. So, returning to the risk group categorization, again, the intermediate risk group is going to be patients with Gleason score 7 or PSA 10 to 20 or T2B, which is the presence of a prostate nodule on digital rectal examination that is larger than 50% of the size of one lobe of the prostate gland. So we're talking here intermediate risk category in this group here. I want to emphasize that risk group categories are a continuum. There's no hard cutoff, but you go from low risk to intermediate and to high. And as you travel along this line, the higher you get, when you start getting into the intermediate zone, the risk of having the prostate cancer break through the capsule of the prostate, which is called extracapsular extension, increases. Also, the risk of seminal vesicle involvement increases, and the possibility of spread to the lymph nodes increases. So, as you go along this line towards a higher risk, those things increase, and that affects which treatments are the best. It shows capsular extension, where the prostate cancer breaks through the capsule of the prostate gland. This is called extracapsular extension. The glands right behind and above the prostate gland are called seminal vesicles, and sometimes the cancer grows from the prostate backwards into the seminal vesicle, as shown here. That would be called seminal vesicle involvement. So when you reach the intermediate risk group, prostatectomy surgery is associated with increased risk of finding these extracapsular extension, seminal vesicle involvement, or lymph nodal involvement. And if those things are found at the time of surgery on the pathological assessment, then there's an indication for post-surgery radiation to kind of clean up whatever cells may have been left after surgery. So as you get higher on the risk group, surgery becomes not a standalone treatment, but it becomes a treatment as part of a package with radiation. So that's just something to be aware of. External radiation in the intermediate risk group requires hormonal therapy. Hormonal therapy works together with radiation and kind of synergistically to help kill more of the cancer. 4 to 6 months of hormonal therapy is recommended, and hormone therapy itself it results in hot flashes and loss of sex drive or loss of libido. So that's with external radiation. And then with brachytherapy, or the seed implantation, due to the fact that there's a very high dose, much higher dose delivered to the prostate gland with brachytherapy as opposed to external radiation, essentially twice the amount of radiation is delivered with brachytherapy. Hormone therapy has been shown not to be needed for intermediate risk patients. Therefore, brachytherapy can be a standalone treatment for intermediate risk patients. And again, if we plot the result from multiple studies, all represented as dots on this graph and color-coded, surgical is red, external radiation only is green, brachytherapy is blue, and actually purple now we have brachytherapy with external radiation. We show that for intermediate risk, The brachytherapy treatment, whether with or without external radiation, seems to be holding at the top of the curative range. So this here is essentially cure, whether you have 70%, 80%, 90% cure, and this is going out to about 10 to 12 year time frame here. So if you look on this graph, the treatments that are withstanding the test of time are the blue, the treatments that contain a brachytherapy component. Surgery by itself is not quite as good in intermediate risk because it requires post-operative radiation therapy, and the potential finding for those extracapsular extension increases in the intermediate group. Very much for watching this video regarding treatment options for intermediate risk group prostate cancer. In the next video, we'll focus on high-risk patients. Thank you very much. Please hit the thumbs up sign if you enjoyed this video.